Welcome to the Victory Education Lounge. I'm your host, Maurice, and today we're diving into a critical topic: cardiovascular disease and insulin resistance. This is part 75 of our ongoing series on health and wellness. Before we begin, please take a moment to like this video, subscribe to our channel, and leave a comment sharing your thoughts or experiences. Your engagement helps us reach more people with this vital information. Have you ever wondered about the link between cardiovascular disease and insulin resistance? Today, we're going to unravel this complex relationship and shed some light on how these two health issues are intertwined. Let's begin by defining insulin resistance. This is a condition where the cells in our body don't respond effectively to insulin, the hormone responsible for regulating our blood sugar levels. When insulin resistance occurs, our blood sugar levels rise, triggering a cascade of metabolic disturbances. Now let's shift gears and talk about cardiovascular disease. This term refers to a group of disorders affecting the heart and blood vessels, which includes conditions like coronary artery disease, heart failure, and stroke. Cardiovascular disease is a leading cause of death worldwide, and its risk factors are multifaceted, ranging from genetic predisposition to lifestyle habits. So, how does insulin resistance relate to cardiovascular disease? Well, it's a bit like a domino effect. The metabolic disturbances caused by insulin resistance can directly and indirectly affect our cardiovascular system. From impairing the function of the inner lining of our blood vessels to promoting chronic inflammation and even making our blood more prone to clotting, insulin resistance casts a long shadow over our cardiovascular health. But it doesn't stop there. Insulin resistance can also contribute to high blood pressure by increasing sodium retention and sympathetic nervous system activity. It can lead to an unfavorable lipid profile with high triglycerides and low HDL cholesterol, both of which increase our cardiovascular risk. And it can even contribute to the thickening of the heart's main pumping chamber, affecting its function. These are just a few examples of how insulin resistance can impact our cardiovascular health. By understanding this connection, we can better equip ourselves to manage and potentially prevent these conditions. So as we can see, insulin resistance can have a profound effect on our cardiovascular health. But don't worry, knowledge is power, and in the upcoming scenes, we'll discuss strategies for managing insulin resistance and enhancing our cardiovascular health. Stay tuned. Now that we understand what insulin resistance is, let's delve into how it contributes to cardiovascular disease. Insulin resistance and cardiovascular disease are two sides of the same coin, each influencing and intensifying the other, creating a cycle that can have profound impacts on our health. First, we need to talk about endothelial dysfunction. The endothelium is the inner lining of our blood vessels. When insulin resistance occurs, it impairs the function of the endothelium, leading to reduced production of nitric oxide, a molecule that helps our blood vessels relax. This impairment can lead to a condition called hypertension or high blood pressure. Next, we have dyslipidemia, a term that describes an unfavorable lipid profile in our blood, which can include high levels of triglycerides, low levels of HDL cholesterol, and a preponderance of small, dense LDL particles. These changes in our blood chemistry increase our risk of cardiovascular disease. Insulin resistance also promotes chronic, low-grade inflammation, a condition that can be a key factor in the development of atherosclerosis, which is the hardening and narrowing of the arteries. Another factor that comes into play is hypercoagulability, a condition that makes our blood more prone to clotting, raising the risk of heart attacks and strokes. Insulin resistance can also contribute to left ventricular hypertrophy, a condition where the main pumping chamber of the heart becomes thickened, which can affect the heart's ability to pump blood effectively. This can lead to accelerated atherosclerosis, as inflammation, dyslipidemia, and endothelial dysfunction speed up the formation of plaques in our arteries. Furthermore, insulin resistance can disrupt our body's ability to break down blood clots, a process known as fibrinolysis. This can further increase our cardiovascular risk. And let's not forget about arterial stiffness, a condition that can reduce the elasticity of our arteries, contributing to high blood pressure and increasing the workload on our heart. Lastly, insulin resistance can lead to microvascular complications. This means that it can damage the small blood vessels that supply our organs, including our heart, kidneys, and eyes with blood. This can lead to a variety of complications, including heart disease, kidney disease, and eye disease. Indeed, the influence of insulin resistance on our cardiovascular health is far-reaching and multifaceted. But the good news is, there are steps we can take to manage and even reverse insulin resistance, and in doing so, protect our cardiovascular health. We'll explore these strategies in our next segment. Stay tuned. Now that we understand the problem, let's shift our focus to the solutions. Managing insulin resistance and cardiovascular disease is not a one-size-fits-all approach. Rather, a combination of strategies may be needed to effectively address these health issues. Let's explore 4 key strategies: regular physical activity, a Mediterranean diet, weight management, and stress reduction. Regular physical activity is a cornerstone of managing insulin resistance and cardiovascular disease. Exercise, from brisk walking to strength training, enhances insulin sensitivity and contributes to heart health. The pros are wide-ranging, from boosting mood to strengthening muscles. However, the cons include the need for consistent effort and time commitment. Remember, it's not about becoming an athlete overnight, but about making small, sustainable changes to your routine. Next up is the Mediterranean diet, a dietary pattern that emphasizes fruits, vegetables, whole grains, legumes, fish, and olive oil. Studies suggest this diet can improve insulin sensitivity and cardiovascular health. On the pro side, it's delicious and nutritious. However, the con is that it may require significant changes to your current diet. But don't worry, the transition can be made easier by introducing one new food or meal at a time. Another effective strategy is weight management. Maintaining a healthy weight can improve insulin sensitivity and reduce the risk of cardiovascular disease. The pros are that it's beneficial for overall health. The cons, however, can be the challenges some individuals face in achieving and maintaining weight loss. It's important to approach weight management with self-compassion and patience, understanding that progress is not always linear. Finally, stress reduction is an often overlooked but crucial aspect of managing both insulin resistance and cardiovascular disease. Chronic stress can exacerbate these conditions, so finding effective ways to manage stress, such as through mindfulness, yoga, or hobbies, is key. The pros are improved overall well-being, while the cons can be finding the right stress reduction technique that works for you and sticking to it. Every strategy comes with its pros and cons, and it's about finding what works best for you in your unique health journey. It's also important to remember that these strategies should be complemented by regular medical checkups and following your healthcare provider's advice. As you can see, there are several effective strategies for managing insulin resistance and improving cardiovascular health. To summarize, the relationship between insulin resistance and cardiovascular disease is complex and significant. We've walked through the intricate ways these two conditions intertwine, painting a comprehensive picture of their interconnected impact on our health. We began with a refresher on insulin resistance, a metabolic condition where cells fail to respond effectively to insulin, leading to elevated blood sugar and a cascade of metabolic disturbances. We then delved into 10 distinct ways in which insulin resistance contributes to cardiovascular disease, from endothelial dysfunction and hypertension to arterial stiffness and microvascular complications. We also explored various management strategies and preventive measures for these conditions. Regular physical activity, adopting a Mediterranean diet, maintaining a healthy weight, and reducing stress levels are all practical ways to improve insulin sensitivity and cardiovascular health. Each comes with its own set of pros and cons, but the overarching theme is clear. A balanced, healthy lifestyle is key to managing these conditions effectively. The information we've discussed today is not just academic, it's a call to action. It's an invitation to take control of our health, to make informed decisions, and to lead lives that prioritize wellness. It's a testament to the power of knowledge and the potential of preventative care. In this journey of understanding and managing insulin resistance and cardiovascular disease, remember that every step counts. Small, consistent changes can lead to significant improvements over time. It's not about perfection, it's about progress. Your health is your wealth, and it's an investment worth making. So let's continue to educate ourselves, to ask questions, to seek answers. Let's continue to strive for better health, not just for ourselves, but for our loved ones and our communities. Let's continue to be proactive, to be empowered, and to be well. Remember, knowledge is power. The more we understand about these conditions, the better equipped we are to manage them and maintain our health. As we wrap up, I want to emphasize the importance of addressing insulin resistance for cardiovascular health. By taking steps to improve insulin sensitivity, we can significantly reduce our risk of heart disease and other cardiovascular complications. Before we conclude, I must provide a brief disclaimer. The information in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Your individual situation may require specific medical attention, and it's crucial to seek professional advice for personalized care. Thank you for joining me in the Victory Education Lounge. If you found this information helpful, please remember to like, subscribe, and share your thoughts in the comments. Your experiences and questions can help others on their health journey. Until next time, this is Maurice, wishing you health, vitality, and a strong, resilient cardiovascular system.